Well, welcome, and thanks so much for joining us. This is going to be an exciting week for Vermont on the healthcare front. As you know, we firmly believe that we can be the state that passes the first single-payer healthcare system in the country. It makes healthcare a right and not a privilege, that follows the individual and that contains cost. The partnership in passing this bill will require the help of the most capable and able congressional delegation in the country, in Senators Leahy, Sanders, and Congressman Welch. It's an honor to have them here today, and I would like to turn this over to first to Senior Senator Leahy to talk a little bit about some of the efforts on their behalf in this partnership that they're going to be working on to help us achieve this goal. Senator Leahy, it's a pleasure to have you.
Thank you, Governor. Governor, thank you very much. And again, congratulations, and I'm glad to be here with you. And with the other members of the delegation. The Governor has spent his career in public office and trying to bring us affordable health care. There are some who want to turn the clock back in Washington and repeal the steps we've finally taken forward in health care. None of us want to do that. The joining with Congressman Welch and Senator Sanders. Senator Sanders has a bill to give more flexibility in the Senate to implement, for states to implement their reform. I'm not going to go down to the whole thing. I'll answer questions on it, but as a Vermonter, I look at the fact that our little state has been a trailblazer in reform for years and years on all things. It's one of the reasons why we're the healthiest state in the nation. And I want to make sure that with the new federal health care, that we can complement it and not be at odds with it. I want to give Vermont the amount of flexibility it needs to do it. In just 10 months, this has helped thousands of Vermonters pay the cost of prescription medication. Let me tell you just one thing. Betsy Krumholz of Vermont has a 24-year-old son. I nominated him to one of our military academies. It was found then that he had early diabetes and couldn't go. That was tragic enough, but then they found that the insurance companies didn't want to give him insurance. Under our health care law now, they have to. And that allows Mrs. Krumholz and her husband to keep him on their policy till he turns 26, and hopefully, as we go forward, to continue it. The Washington Post today had a story that nearly half of the people under 65 have pre-existing conditions, and insurance companies normally, without the health care law, could say they couldn't have health care. Wealthiest, most powerful nation on earth, that's wrong. Thank you.
Thank you, Senator. Appreciate it.